Hey guys, welcome back to All in Law. In this video, I'm going to discuss briefly about important points about ischemic colitis. Ischemic colitis. Ischemic colitis name itself indicates there's a ischemia in the colon, right? So it's called as ischemic colitis. So what are the important points that you should remember? Remember, if there is any patient with the diabetes mellitus, atherosclerosis, congestive heart failure, peripheral vascular disease, or SLE, that is systemic lupus erythematosus, if these patients present with acute abdominal pain, diarrhea, that is a bloody diarrhea, vomiting, okay, and abdominal tenderness, then think of ischemic colitis. Okay, so let me repeat. If a patient with a diabetes mellitus, atherosclerosis, congestive heart failure, or CHF, okay, or peripheral vascular disease, systemic lupus erythematosus presents with acute abdominal pain, bloody diarrhea, vomiting, mild abdominal tenderness, then it could be ischemic colitis. Okay, right? So what is the cause for ischemic colitis? Is nothing but it's an embolus or bowel obstruction, inadequate systemic perfusion. Okay, if there is any surgery, right, vascular compromise is there because of the surgery, medication could cause. So these are the causes that can cause ischemic colitis. Okay, so what are the investigations you look? Try to look for serum lactate, and the serum lactate is raised. Serum lactate is raised. Okay, so if you take out the what you call a barium enema, it shows thumb printing. So what's a thumb printing? Just Google the images. Thumb printing. So it's nothing but diffuse submucosal changes from localized bleeding. Okay, there is a diffuse submucosal changes from localized bleeding. And if you do sigmoidoscopy, it shows what? It shows the blood, right? And edematous mucosa, remember. And if you take out the CAT scan, then it shows air within the bowel wall, right? Because of the ischemia, right? And the bowel wall thickness, if you measure, it will be more. Okay, right? So how would you treat that? Usually in the step 2 CK, they will ask you the diagnosis, but in a step 2, step 3, they will ask you the management. What is the next best step? Remember, the patient should be stabilized with intravenous fluids. Give the bowel rest. Very important points. Intravenous fluids, bowel rest, and you can start with antibiotics. Okay? And if you have done the CAT scan or the CT scan, then if there is any surgical correction can be done, then you can go ahead with that. Okay, so these are the really very important points about ischemic colitis. Okay guys, so remember, any patient of diabetes, atherosclerosis, congestive heart failure, peripheral vascular disease, lupus presents with acute abdominal pain, bloody diarrhea, vomiting, or abdominal tenderness, then you should think of ischemic colitis. Okay, so thank you so much for watching this video. Take care.